and talk about capital projects.
You have slides, Terry? Or no?
I do not have slides. There you go. Good morning, everybody. So capital projects, the UCSF research facility continues its site preparation, and they're concentrating on the installation of fire water, a rerouting of the fire water. Fire water is what supplies our sprinklers in the building with the water to suppress any kind of a fire event. And so they're rerouting a new line, and that's what they've been focusing on. The first part of that project, of course, is going to be to build a new roadway, which will open in about 9 months, and then the rest of the project will be building the building. Other projects that we have going on campus, 6H Surge office space is scheduled to be completed by the end of the month, and then there'll be a period of time of fit up that we'll go through before it's usable. Our rehab relocation also is scheduled to be done at the end of the month. And then that will have a transition period also, and also a possibly a licensing component. Second floor poison control is scheduled to be completed in early November, and that will allow poison control to move over from the CHM building over to building 5. So following all these projects, there'll be a fit up and transition period. And then with all the other upcoming projects, we've engaged our general contractor, Pancow, who's been producing planning documents, and they're going to be starting with the seismic retrofit of the building early 2021. They'd like to get a real early start in January. We don't think that they're actually there in January yet, but as soon as these plans get hardened up, we'll be reporting back out to when this will happen. The first phase of the seismic work will impact the pharmacy, outpatient lobby, and there'll be a reconfiguration there. Throughout the entire seismic project, there'll be all sorts of inconveniences that we'll have to route traffic around. Some corridors will be shut down, and you may have to go from one floor to another floor to get back to the same floor. But we'll have this all mapped out, and we'll be sharing that information with everybody. So at the also at the same time as the pharmacy work, Pancow will be working on the Clean Lab project above, because the plumbing for that project is right above the seismic work in the pharmacy. So we're going to try to kill 2 birds with 1 stone there. We've been running our temporary backup at the chiller for at the power plants. That has been going well. That has been a lifesaver with these extreme heat that we've been experiencing. And that will be a continued event that we'll be bringing in every year for the heat until our chiller project is slated to be completed in 2023 will be completed. Other work on other projects are continuing, family health center, psych emergency, all those are in design. Parking. As I reported last time, October 1st, parking will be back to where it was pre-February, where parking restrictions were lifted. So now all parking programs are back in place. I do want to point out that we are providing ADA parking since it was impacted from the construction in the parking garage, and if that would be fill up, there would be valet that would support ADA parking in the parking garage. See, the building 5 roof work was completed, and also we are releasing parking permits for the garage and campus at 25 at a time, and we're going to monitor the usage. It's really hard to gauge the usage because of the COVID events has really reduced traffic on campus. So we will take a slow approach at releasing permits. If you're on a waiting list, then you've been approached by Laz Parking about the parking permits, and you should reach out to them to gain a permit. That completes my my report.
Okay, before you go anywhere, a couple of questions. Is 4A moving to the 7th floor to accommodate seismic work?
So 4A will have to be relocated for a period of time, no more than 6 months, 180 days, to support the seismic work. So occupants of 7A will be relocated to 6H, and then the occupants of 4A will be temporarily located to 7A. And then they'll return back to 4A.
And do you have any feeling as to when that might happen?
Oh, that needs been floating around there. We were talking. I'm looking at Susan gave you a date of late 2021, I believe. All these dates have to harden up. They've been floating around, and as the plan gets hardened up, we'll be sharing that information.
Okay.
But it's quite some time away.
Okay. Could you repeat what you said about pharmacy, outpatient pharmacy, Clin Lab?
Sure. The whole area, there's a column there that needs to be strengthened, and there's some piping above the pharmacy that supports the Clin Lab project. And so there's about half of the pharmacy, outpatient pharmacy is going to be impacted. And so we are going to be moving the stations from the outpatient registration into the main lobby, which would provide space for the pharmacists to dispense or distribute. They're going to work in half the space for the period of time. They're actually going to dig down about 16 feet to build a column adjacent to the existing column. And so that back dispensing window won't be available during that period of construction. And again, that's going to start early 2021.
And the last question right now is about air quality. What special steps did we take for that? How did we do during the last kind of really smoky event?
Well, we fared a lot better this time around than we did. Was it 2 years ago when we had the extreme smoke event where we actually had some damage to our filtration systems? Since then, we have repaired all the filter racks, strengthened them. We've got a monitoring system in place where we're monitoring the differential pressure between the filters every day, and we're just not seeing the numbers that we saw in previous events. We've done one filter change since the smoke conditions occurred, and we've been monitoring ever since, and we're still looking pretty good. We have not seen in the buildings that have mechanical systems that are filtered, we have not seen anything that's troubling.
Thank you. Don't go away. I mean, go away from this chair, but don't go away
I'm gonna go over there
from the room. Yeah.
Right.
Thank you so much, Terry. Super. Okay, so again, if you're watching this live, use the chat function and we will get to your questions as soon as we can. Next up is Jennifer giving us an update on the budget.
Good morning, everyone. The long-awaited budget from delay process has finally been settled as of this month, and the finance team is currently in the process of reconciling and making sure that each department actually gets their budget. But just to get you a high-level overview of where we're at and what changed. So as you can see, we initially had asked for $994 million, and we're getting $987 million. The biggest difference for us is sitting in the salary and fringe bucket. And that is really related to the fact that we had submitted a number of investments this year back in the early budget process. It was a very different climate. We assumed we would get to add a number of initiatives and FTEs that we had been wanting to enhance some of our projects and operations here at ZSFG. We did have to back those out of our budget. The other thing that we did is we really looked at tying the RN hiring and look at our utilization of P103 and see if we could make a reduction there. Other than that, things in our budget stayed mostly stable. We have no job losses at this time, and we're really focused on supporting critical work at Zuckerberg with this budget. The other change you'll see mostly lies in our materials and supplies. and that is due to lower volumes in both the inpatient and outpatient clinical settings. We believe that that's an achievable target. I should also mention that in our salaries for 2021, we do have a commitment to redeploy $12 million of that salary to our COVID operations. In addition to that, we did make a request for $23.5 million related to COVID operations in 2021 budget year. We were funded on the DPH side for 11.8, and that's where the ask for the additional 12 in redeployment from the Department of Public Health and the city is coming from. Things that were funded are if we need to open H52, our forensics unit, the additional opening of a critical care unit, and the expansion of our urgent care department into the Building 5 lobby. And the last thing is the pharmaceutical support of our hotel SIP population. The other thing happening across the Department of Public Health are investments in human resources to help strengthen the hiring across the department, as well as here at ZSFG. The investment in our quality management department to create a Department of Public Health and network quality service line, which will also be beneficial for us here at Zuckerberg. There are some maternal child health equity initiatives that did get passed, as well as the expansion of pharmacy into specialty care drugs. The finance team will be reaching out to work with you on your individualized budgets after the reconciliation process, which will be the month of October. And I believe that is all we have today.
Okay, can I ask you a question before you go?
Sure.
So, no job losses, right?
Correct. As of right now, we are very focused on no layoffs from Zuckerberg and the Department of Public Health.
Great. Could you explain again? So we have part of the budget that's going to COVID programs. Does that take away from the core business?
It does not take away from the core business. So what we're doing is we are looking at where we have changes in volumes related to the work that we used to do, and then shifting those resources to the new work that has come up as a result of COVID. So like if you were to look currently at our inpatient volumes, our outpatient clinical volume, we're sitting at 85% of prior year baseline with the same number of resources that we had. So we're shifting and asking those resources to look at redeployment opportunities.
Can you give some examples of what the redeployment might look like?
Sure. So I think everybody has seen the staff screening area when you come in, visitor screening, patient screening, have a number of staff from the operating room, from our outpatient clinical space, from care experience. We even have finance team members redeployed to that area. Some of our team members are redeployed to occupational health and safety. Some are deployed down to C3. So there's a number of different activities happening on campus, as well as DPH-wide to support the city's COVID response that we're redeploying to.
And do we have a sense of kind of how long a period we can expect to have those redeployment, that redeployment happening?
You know, it'll depend on what happens with COVID. I would say for right now, we can consider that normal business, at least for fund year 2021. In terms of when that will change, that'll really, I think, be more on what happens with infection control, what happens with the health orders, what happens with the availability of a vaccine.
And before you go, there's a question about the implementation of raises. Do we have a plan as to when that's going to happen?
So currently, if you have seen the mayor's press release, the COLAs are included in the budget. I believe the initial increase was planned for December. I will have to follow up and confirm what the actual schedule is.
Great. Thank you so much. Okay. Don't go far.
Okay.
Okay. Thank you. So we're going to check in about COVID and mostly about infection control. I know this would normally be the time of year when we would talk a lot about the flu, isn't it, Elaine? We would start to talk about that. So Elaine, why don't you come over and share the information that you can?
Okay, we will still be talking about flu.
Good.
So flu, unfortunately, is something that we still have to be worried about. So this is Elaine Decker, the Manager for Infection Prevention and Control. And I just want to give you a little bit of an update about where we stand today. As of this morning, we currently have 9 COVID-19 patients in-house. 3 of them have had their isolation stopped. They're no longer considered infectious, but they are still requiring acute care hospital level care, so they are still with us. And then 6 are admitted and considered infectious and in the proper isolation. So that's kind of where our hospital is as of this morning. In terms of some of the questions that people might be having, I do encourage everybody to continue to use our COVID-19 FAQ website. We have updated our ED and inpatient guidelines, as well as our outpatient guidelines to address the updates made by San Francisco Department of Public Health for how to discharge patients to the community and when their isolation can be discontinued in that setting. And there are some nuances that are different from how we were doing it in the past. So we are working with our teams. We are continuing to have our COVID-19 clinical call every morning, Sunday through Sunday. And we always address isolation and discharge during that call. In terms of our personal protective equipment, we monitor that level daily. We have not yet made any changes to our processes. And again, those are all included on our COVID-19 website, but we are following it closely. And as supplies ebb and flow and our census ebbs and flows, we will be addressing those issues if they should come up. I kind of think that's all I have for COVID-19 right now.
Want to go to flu?
We'll go to flu. I want to thank everybody who's already received their influenza vaccine. The last I heard, our numbers were greater than 70% for DPH employees being immunized. But we still have a ways to go. We're hoping to hit 90% by the end of this month, Halloween. And we do know that there have been a couple of influenza cases seen in the UCSF population. We know those were influenza A. I believe there were 2 so far. And there were a few of influenza Bs in the East Bay. We have not yet had our first pit positive in our population, but we're not seeing a lot of testing happening yet. And that is one of the things that will drive our processes, our laboratory capability. So we are working with our lab department to get the best test possible for flu as well as COVID-19 to keep our flow going. And I would encourage everybody, if you have a patient who is tested negative for COVID-19 but has a cough, remember we're still wearing our isolation masks for all of our encounters and our eye protection, which will protect, but we want to make sure that we're thinking other respiratory viruses as well, because this is the start of that season. And we have seen some of our other upper respiratory illnesses, such as our rhinoenterovirus, and I believe we've had a parainfluenza as well, and an RSV. So it is respiratory viral season. We don't yet know. We're hopeful that COVID will continue what it did last year. Flu kind of ended and was very minor after COVID-19 started, and our hope is that that will continue this year, so we don't have 2 major respiratory illnesses circulating at the same time. So that's why it's very important that we all be aware of our own respiratory health as well as our patients. I think that's all I have.
Okay, got a couple of questions for you as a
Okay.
follow-up. Tell us again where people can go to get the online information about COVID, the up-to-date stuff.
For that, you would go to the CHN intranet, and you know how they have the big red emergency button? Right below that is our COVID-19 FAQ link. Kind of works well. It's like, I think, on the 3rd row down on the home page for the intranet, and that will take you to the website. And when you get there, at the top is like a lavender table, and in that table, you'll see links to all of our documents, such as our no-do shares for our PPE. We still have the links to the YouTube video that was done by our MedSurg colleagues to show how to properly don and doff your PPE to allow reuse. We have treatment guidelines there for the physicians to be able to use to see all the different options that are now available to us, to include remdesivir and some of the research trial projects that we're involved with. And also very important, occupational health, their link is there to their document for return to work and exposure information. That is also on that page. So we've tried to make it a one-stop shop for a lot of our key documents for people.
Great. Let's jump to flu.
Okay.
How can people get vaccinated?
Still doing influenza vaccine Mondays, Wednesdays, and Fridays in the Wellness Center. I do not know the last date for that, but they are still continuing that process. UCSF has left the campus. They stopped their vaccine program at the end of September, but they have left the equipment to allow immediate entry of UCSF personnel who can be vaccinated by our DPH staff at the Wellness Center. And then, of course, you can also go to their building, Building 9, first floor, and you can get vaccinated there. And they are doing roving, where they are going to areas and working with managers and supervisors who have a large number of staff. They want to schedule a visit. The roving clinic will come there. And there are still champion areas. So if your area has a champion, you can ask your manager if you're part of that program, and you can be vaccinated in your own unit by your own department.
So Wellness Center for DPH employees.
And UCSF.
And UCSF, Building 9, and rovers, and managers can schedule
Special sessions.
sessions for their people.
Yes.
Okay,
Okay.
thank you.
You're welcome.
Susan,
Great. So good morning, everybody. I can't see you, but it's nice to be with you. I first wanted to thank the organizers of this management forum. So Brent, Kim, and Casey, who work really hard to make this a forum that is informative and high quality for all of you. So I want to thank them, and I also want to thank our presenters this morning, Terry, Elaine, and Jennifer, for their topics. And I also never want to miss an opportunity to thank all of you. I know that managers have one of the hardest jobs here on campus. You're kind of between the executives and the frontline staff, and I know that it's always a challenging place to be. And there's been no more challenging time than now. I want to thank you for your resilience, compassion, your creativity, and your care for one another. So thank you a lot for all of that. I just wanted to add a little bit to Elaine's remarks about COVID. So right now, citywide, we're at another low point. The last time I checked, there were approximately between 30 and 35 people hospitalized around the city for COVID. And just by the way, San Francisco has a really tremendous public website for data. SF COVID has just all kinds of information, including case rates, hospitalizations, information about schools. There's just a huge amount of data there, and I really, if you haven't seen it, I would commend that to you. So we're at this low moment with cases. I think the lowest we've had in the hospital recently is 5 patients. We have a little bit of an upswing recently, but it's quite low. We seem to have dodged the bullet for the Labor Day surge. We had a big surge following Memorial Day weekend. We didn't see that this week with Labor Day, but we did have a very significant opening of places, as you know, at the end of September. And right around now is when we would see increases related to that. We also expect, but aren't certain about, having another surge of COVID cases related to the winter illness season. And that's why it's so incredibly important for you all to get your flu vaccination. So please do that. Please encourage your teams to do that. And please also make sure that at home and at work you're wearing masks as appropriate. and washing your hands, keeping your distance, doing all those things that we know are incredibly important to keep the burden of COVID illness down. I think I saw a question about how many total COVID patients have been admitted to the hospital. Well, I know not that long ago we hit the 500 mark. Elaine, I don't know if you have anything more. Yeah, but maybe a couple weeks ago we hit 500 patients total, which is really a significant number if you think about it. That's been since the beginning of March. So that's approximately how many patients we've seen here. And then I'm happy to answer any other questions. Anything you'd like me to cover more, Brent?
So there is a question, which maybe you can answer, maybe Terry can answer, about securing buildings 90, 40, and 30.
Yeah. I'm going to defer to Terry on that. It would be good to know what specific questions people have, but why don't you take that away, Terry?
So one of the outcomes of our COVID response was to restrict access to the buildings that don't have a lot of public access. And so you saw us restrict access to the main lobbies in building 25 and 5, and then the main building 90 lobby in the 80-90 buildings. The buildings 1, 10, and 20 were secured so that only staff get through with a restricted with a badge. 9, 30, and 40 created an interesting problem because there was a lot of, there's clinics in building 9, and so we couldn't really close it down to all public. So what we have done is we've installed a new door between 9 and 40, and we're going to be restricting access from the entrance of 30 to that new door. And there'll be card key access, and for public access, there'll be an intercom that they'll be able to either call on a phone to somebody that's in the building and they can be buzzed through, or they can use the intercom and be buzzed through. That is, the doors have already been installed, and we're waiting for parts to be delivered for us to install the low voltage components for the card access and the intercom. So probably within the next month, that'll be activated.
Thank you, Terry.
Sure.
So Susan, here's a question for you.
Yes, Brent, what is that question?
I feel like I should set up a joke somehow, but the question is, are we still, I know we've been expecting a big wave of COVID cases. We thought at first it was going to be October. Are we thinking still that a big wave is coming like in November, December?
Yes. Well, we have just an outstanding group of people at the command center, led by Dr. Jim Marks, the advanced planning group that is just doing, just poring over all the data and looking at all the evidence to try to understand where this disease is going, in particular in the city and county of San Francisco. And there's only so much certainty we can have about the future. I think generally, as I mentioned before, there is a thought that there will be another surge that coincides with the regular flu and winter illness season. But the size and scope of that is really hard to say. I think that's the best I can do right now. I mean, right now, as I mentioned, we only have about 30 to 35 patients hospitalized citywide. That could grow considerably into the many hundreds of patients, but we don't really know. We should, though, as a result of the reopenings that started happening, the big surge of reopenings that started happening at the end of September, one would think that we would start to see evidence of illness related to those reopenings starting about now. And so, we'll just have to see. I mean, the great thing about us now is that we know so much about how to manage this pandemic. We really have our processes, our surge plans. We have all of that stuff pretty well nailed down. And so I think, we'll be able to handle whatever comes our way as best as we possibly can. And we also, I would say, have a really good relationship with the other hospitals and with hotels and many resources in the city to even out the burden of the illness across the city. So that's been a really incredible thing to see. So I feel, it's hard to say where it's going, but I feel good that whatever comes our way, we'll manage as well as anybody could.
And
Yeah, Elaine would like to
Elaine,
add
come on over.
something. Please come up.
Just because I've been paying a lot of attention to what's happening
Yes.
in the rest of the country. Hi, this is Elaine again, and I thank everybody for thinking about this next surge that may be happening. I think it's important to recognize we are very fortunate here that people have cooperated and really followed all of the directives and requests of our Department of Public Health. And it's really important that you continue to do those same things. As I heard somebody say on the television interview, people are getting COVID fatigue, but the virus is not fatigued at all. And so you can kind of watch what's happening in other parts of the nation and the world. They are indeed experiencing either their first surge in the Midwest or their second surges in Europe and other countries. I think the most important thing to remember is even though our numbers are low, they're low because of everything that the people have been doing to keep them that way. So the most important thing is don't allow yourselves to kind of let your guard down. Keep masks on, keep your nose covered. When you're here in the hospital and seeing patients, keep your eyes covered, and just encourage your friends and colleagues to do the same. And we still want to remember it's important to avoid large gatherings. We're starting to see more talk about parties and weddings and things like that. And indeed, people want to celebrate, but you do need to be small and selective so that you can, again, keep avoiding those large events where you can see spread occur. I think that's all I really wanted to say.
Yeah.
thank you, Elaine.
Thank you.
That's really helpful.
Yeah,
Um,
that's really helpful, Elaine. Thank you so much for that reminder. Yeah, I mean, as people start moving indoors, especially, it's hard to imagine that given the beautiful weather that we had over this past weekend. But as people start moving indoors into less well-ventilated areas, this is when we see the risk really, really going up, but also large gatherings of any type.
So Susan, I'd like to ask you a little bit about resources. And that is, we have the LACC, which anticipated a bigger growth in cases than we actually have had so far. And there's a, huge dedication of resources at the COVID Command Center. Do we anticipate that scaling back a bit, or are we kind of going to stay where we are until we kind of figure out where the trajectory is?
Yeah, so the city has a tremendous amount of resource dedicated to this pandemic in a lot of different ways, which is great, and is a lot of the reason why we have such a few number of cases and a few number of deaths in the city. I don't see any evidence the city is going to reduce the number of people attached to the COVID response. I think more is how those people are organized and whether they stay at the command center or whether they come back to the departments to do their work. Those are the kinds of things I think people are talking about. It's a balance between wanting to continue to respond in the most robust way to the pandemic, and at the same time acknowledging that people want to live their lives. The city wants to get back to business as much as possible. And so it's really looking at the balance between those things and striking an appropriate balance. But no, I don't see for the foreseeable future that the city is going to let up on its COVID response. In fact, right now is the time when we really need to be very diligent and resilient because of the coming of the winter flu season.
Have you just, you live in the city, you work in the city. Have you seen a lot of people availing themselves of what's now open that hasn't been open before, like restaurants and that kind of thing?
Yeah. Yes. I mean, people are definitely out and about. I was in Golden Gate Park this weekend, and what was really nice to see was that people were out and they were enjoying the beautiful weather, and they were masked. And that is really different. I mean, I think, just anecdotally, what I've seen is people really being attentive to wearing masks. there are exceptions to that, of course, and there are exceptions to people following the rules. But, by and large, people are doing the right thing, and they are, and this is why we see where we are in the pandemic right now.
Okay, let's see if there are any other questions coming up from, no? Okay,
No.
well, anything else you want to share? Anything else on your mind?
I still want to just say how grateful I am to everybody for your resilience, your compassion, and your creativity during this time. We still have a ways to go with this pandemic, as you know, and we will be working together through all of that. I hope that, whatever you need from me and the executive team to support the work you do, you'll reach up to us to let us know. The main thing that I want to be sure of is that we're all working together and we're all supporting one another through this really remarkable time. So thank you very much. And with that, we'll see you next month. Thank you.